What is a disc herniation? You know, my patients are really afraid to hear that word, disc herniation. There's a lot of facts, but also a lot of non-truths about disc herniations. And I'm going to be here explaining what that is. So first of all, the disc is the cushion between our bones, right? We have bones in our spine. It's kind of like a roller coaster that goes from our neck all the way down to our lower back. And these are like the shock absorbers, right? It's like the tire in your car. The way I explain it to my patients is the disc is sort of like a donut because there's two parts to it. There is the crust and then the Boston cream in the middle. The problem is when that Boston cream comes out and hits a nerve, what do you get? You get a pinched nerve, right? It causes pain down the leg, right? It can also cause pain in the back. So let's go a little bit more in detail about the different subtypes. So here is that outer shell, the crust, right? And in the middle is the Boston cream. If there's any defect, any damage to the disc, well, guess what? That Boston cream can come out and pinch a nerve, right? So let's talk about the subtypes a little bit more detail. So if you look at, this is what we call the continuum, right? As we age, as we do our activity, whether we're biking, whether we're running, we break our discs, right? There's some genetic component to this as well, right? Some of us have diabetes, some of us have heart disease, and some of us have disc disease. It's one of the most common problems that we face. So as this starts to wear out more, right, the outer crust, then the disc, the inner part starts to blow out. This is called a prolapse, like a blowout of your tire. Or you can have a disc, the jello actually extrude out, right? And the last step is it actually comes all the way out, right? It's not contained by that disc anymore, right? So I'm going to show you an example of one of my patients who is really suffering from a disc herniation, right? And we're going to go through all the stuff that I had to review with him so you can get a better sense of what a disc herniation is. So first of all, we get x-rays, right? We want to know what is the structure of that patient's spine. And what you notice here is he's not standing straight, right? He's leaning away from that side that hurts. He's trying to take the pressure off that nerve, right? So that's the first clue that we have with imaging that we obtain in our office. The next imaging that we're going to obtain is the MRI, right? This is the image that we all are familiar with. It's that tiny tube that you have to go in and it's really loud, and you know, a lot of my patients are claustrophobic. But it's really important to get this, right? Because it shows us what that disc looks like. It shows us, is that piece of jello, right, that Boston cream, is it coming out and actually hitting the nerve? And how extensive that is determines what the treatment is, right? The great news about disc herniations is 90% of our patients get better with therapy, with conservative treatments. Sometimes they need an injection with cortisone to reduce the inflammation. But for the most part, we can get patients better and back to their lives without surgery, right? What we're trying to do typically for 3 months is to give the body a chance to resorb this, right? There are these cells in our bodies that can actually go and eat that piece of jello and take the pressure off the nerve, which is great news.